Hi everyone. In today's clip, I will talk a little bit about osteoporosis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So osteoporosis, just like most other disease, is caused by many factors, including deficiencies of essential nutrients such as, let's say, vitamin D. But the fact is that the central belief has been around promoting just prescription drugs and calcium supplements. This sounds simple and straightforward, but unfortunately, not only does it not work, it may also be harmful. There is a tremendous amount of data showing that lifestyle, nutrition, toxins, and hormonal imbalance have an impact on bone health and osteoporosis. In a recent issue of New England Journal of Medicine, an article was published claiming that vitamin D supplementation does not improve osteoporosis. Forbes magazine basically immediately jumped the gun and said, stop taking vitamin D already. So vitamin D is more than just a vitamin. It is more like a hormone with a variety of effects on the body, including immune boosting effects. Because vitamin D is involved in many aspects of health, maintaining an adequate level is critically important. Yet many individuals are deficient, which has likely increased the rates of various ailments and even death rate. There have been many clinical studies of vitamin D3 even in the last couple of years, including a special collection of micronutrients for viral infections. An adequate level of vitamin D also ensures that the body gets enough calcium from the diet. The role of vitamin D goes far beyond the metabolism of bone and calcium. Vitamin D regulates about 2,000 genes. A deficiency leads to osteoporosis being one of the issues. During bone growth and development, vitamin D plays an important role in bone density. Therapeutic doses of vitamin D reduces many causes of mortality. A healthy adult taking 1,000 international units of vitamin D3 or D2 a day reaches their peak blood level within 5 to 6 weeks. In severe cases, your healthcare provider may actually prescribe 50,000 international units of D2 once a week for 8 weeks. People who are obese, for example, usually need 4,000 to 6,000 international units a day. Prescription drugs and calcium supplements alone have no significant benefit for treating osteoporosis. So some of the highlights of the relevant research was vitamin C and its effect on osteoporosis. Increased oxidative stress in the bone is accompanied with an increase in C-reactive protein or CRP. The level of CRP can accurately predict fracture risk in elderly with osteoporosis. High-dose vitamin C can significantly reduce CRP and many other markers of inflammation. Vitamin C stimulates the development of osteoblasts. These are the cells that form new bones and grow and heal existing bones. So dietary vitamin C, which is negligible compared to the level provided by vitamin C supplementation, doesn't reduce the risk, the fracture risk. So elderly osteoporosis patients with a history of fractures have shown to have significantly lower levels of vitamin C than those without a history of fractures. Supplementation with vitamin C significantly increases bone mineral density in all bones and accelerates fracture healing, as well as improves the strength of the healed fractures. Magnesium is another thing to consider. Magnesium is a natural calcium antagonist. Magnesium dissolves calcium deposits in soft tissues And magnesium deficiency leads to severe increase in calcium between cells, which is not a good thing to have. Magnesium increases bone density and reduces fractures, as well as reduces all-cause mortality. Usually, supplemental doses have shown no toxic side effects. Then there's vitamin K. Vitamin K inhibits calcium deposit from forming in soft tissue, such as blood vessels, organs, and joints, and helps dissolve deposited calcium in organs and arteries. We also know that warfarin, for example, which is a common blood thinner, can cause this kind of calcification, which vitamin K will neutralize, as well as the fact that it reduces fracture risk and improves bone quality. So adequate intake of vitamin K reduces cardiac and all-cause mortality. And tried at any dose, there has been no apparent toxicity. Hormonal imbalances like estrogen in females and testosterone in males, as well as thyroid hormones, are also a factor in developing osteoporosis. Some essential fatty acids have calcium channel blocking capabilities, and they have shown to protect bone mineral density. And EFAs, or essential fatty acids, are not toxic, but they may cause gastrointestinal discomfort if you take them in very large quantities. So sufficient exercise, outdoor activities, relaxation, and sleep, nutrition-rich, anti-inflammatory, healthy diets, which include low carbohydrates, sufficient proteins, and healthy fats, as well as minimizing processed foods and synthetic food additives, chemicals, antibiotics, and hormones, and other environmental pollutants are all quite helpful. In addition to adequate doses of vitamin C, D, E, and K2, and magnesium supplements, macro and micronutrients play a significant role in the prevention and reversal of bone health and osteoporosis. On the metaphysical side of this, mental anguish, like fear, especially fear of authority due to lack of own self-worth, or even being controlling, depression, or psychological stress can cause this. On the emotional side of it, it could be related to that the person suddenly realizes that they're no longer what they were before. For example, attractive, agile, fast, daring, etc. Or perhaps the devaluation could have happened to trigger by insensitive or unfair criticism, by feeling belittled because someone makes them feel physically old. And of course, if they do not get along, they feel that they have lost weight or strength or credibility in life, then the bones will lose their density and they will begin to sort of disappear, disintegrate, erase, etc. Or if they feel that their work is devalued. It also can be a warning of a loss of identity in some aspect of their life, be it on a sexual level, in the role of mother, father, spouse, etc. Finally, another emotional conflict that can cause someone to have osteoporosis is related to their desire to flee or get away from a person or situation that they can no longer tolerate. In order to carry out that, their subconscious weakens their bones in order to make them lighter, so to have a better chance of flying away from this and distancing themselves from the situation. Hope this has been of some help. Like and follow for more. Be the light.